Welcome to BX Insights, where curiosity meets inspiration. Buckle up, people, as we understand and unravel the riveting complexities of the U.S. healthcare system in this video. The U.S. healthcare system is a multifaceted amalgamation of private and public components, functioning within a framework that is notably distinct from the universal healthcare systems prevalent in various European countries. This distinction arises from a complex interplay of historical, ideological, and economic factors that have shaped the nation's healthcare landscape. Central to this differentiation is the limited government involvement in healthcare, a phenomenon rooted in the country's historical emphasis on individual freedoms, aversion to excessive bureaucratic control, and the accommodation of diverse political ideologies. In the United States, healthcare provision is facilitated through a diverse array of mechanisms, including private health insurance, employer-sponsored plans, and various government programs such as Medicare for seniors and Medicaid for low-income individuals. This multifaceted approach leads to a mosaic of coverage options, resulting in significant variations in terms of both access and costs. Unfortunately, this fragmentation leaves a considerable portion of the population either uninsured or underinsured, rendering them susceptible to exorbitant healthcare expenses and limited access to comprehensive care. This stands in stark contrast to the universal healthcare systems in many European nations, where every citizen is entitled to basic healthcare services without the constraints of insurance coverage. One of the prominent repercussions of the decentralized U.S. healthcare structure is the intricate web of billing procedures and administrative inefficiencies that burden both healthcare providers and patients alike. The lack of a centralized system often translates to complex and convoluted billing processes, imposing considerable administrative overhead on medical institutions and creating confusion for patients attempting to navigate the intricacies of their healthcare expenses. This divergence from the streamlined billing systems found in countries with universal healthcare further exacerbates the complexity of the U.S. healthcare ecosystem. While the U.S. has witnessed remarkable advancements in medical technology and treatment modalities, it continues to grapple with issues related to unequal access to healthcare services. Disparities in accessibility are often intertwined with employment status and income levels, effectively creating a divide between those with stable employment and financial resources and those without. The absence of a comprehensive safety net for healthcare in the U.S. often leaves vulnerable populations, including the unemployed and those in lower socioeconomic strata, at a significant disadvantage in terms of accessing critical medical services. Adding to the fragility of the U.S. healthcare system is the uncertainty surrounding the reliability of coverage. The current system links healthcare coverage to employment and private insurance plans, leaving individuals and families vulnerable to abrupt disruptions caused by job loss or changes in their insurance situation. Such fluctuations in coverage can lead to a cascade of negative consequences, including gaps in essential medical services, delayed treatments, and a pervasive sense of insecurity regarding healthcare access. A tangible solution to fortify the U.S. healthcare system and catalyze its evolution towards a more accessible and universal framework is the implementation of a government-backed universal healthcare system. This transformative approach could be realized through various mechanisms, such as the expansion of existing government programs like Medicare to encompass the entire citizenry, or the creation of a novel system designed to ensure essential healthcare coverage for all individuals. Such a paradigm shift would offer the advantages of streamlining administrative processes, mitigating the challenges associated with the multiplicity of private insurance options, and establishing a foundational principle of equitable healthcare access for all, regardless of their employment status or financial situation. The adaptation of a universal healthcare system in the United States is impeded by a complex interplay of historical, ideological, economic, and political challenges. Rooted in a tradition of individualism and limited government intervention, cultural beliefs emphasize personal freedoms and choices, creating resistance against extensive government control, including in healthcare. Ideological divides within the political landscape, as well as the influential power of interest groups such as private health insurers and pharmaceutical companies, further hinder progress. Concerns about potential declines in care quality and accessibility, economic implications like tax increases, and fears of disruptive changes add to the obstacles. Moreover, the entrenched dominance of private insurance and employer-based coverage, coupled with political gridlock and a lack of public education, contribute to the complexity of achieving a universal healthcare system. Despite arguments for equitable access, streamlining administration, and improved care, the realization of such a system requires addressing these multifaceted challenges through comprehensive planning, public education, and political consensus building. So, what's your take on this? We'd love to hear your thoughts in the comments section below. Share your insights, questions, or even your own experiences. Thank you for watching. Don't forget to like, share and subscribe. Until next time, stay curious, stay inspired.